Total knee replacements are becoming increasingly common. That's in part because the surgery has gotten really robust and the outcomes are really good. Some people wonder when the right time to have a total knee replacement is, and that's really a conversation between you, your surgeon, and I would argue your physical therapist. When we look at the research, one of the better predictors of good outcomes are when that knee is limiting the things you enjoy doing, not necessarily when that knee is so painful you can't take it anymore. Pain is not the only measure of what you're able to do. When your knee limits you from going out and doing the things that you enjoy doing, it's time to consider whether or not the arthritis in your knee is limiting you and have that conversation with your orthopedist. One thing that has been shown to be a complicating factor for total knees is if we wait so long into such excruciating pain that we become weak, then when we have the knee replaced, you can't use the equipment that they've put in. Your rehab becomes protracted. You will continue to walk like you have a limp, like you have an arthritic knee, even when you don't have arthritis in your knee because you don't have bones in your knee. They've been replaced with titanium and plastic. Getting your knee replaced before it's just the absolute end of the line has been shown to give faster recoveries and get you back to the things that you want to do and the reason you had your knee replaced in the first place. So it's okay to have that conversation, and no one's going to make you have the surgery before you're ready, but it's okay to have that conversation before there's really no other option. After you've had surgery, starting rehab is critical. Unless there's some other complication, you're likely to start rehab in the hospital the day of surgery. In very rare occasions, although increasing as the surgery gets better, people are having same-day surgery at outpatient surgical centers and going home. It's still uncommon, but if you're young, otherwise healthy, and just happen to have arthritis that sets you up to a place where you need a total knee earlier in your life, it's a conversation that you can have with your surgeon, seeing if they have the capacity, if they think it's a good option for you. After you get out of the hospital, some people will have home health physical therapy for a short period of time, but really, again, when we look at the research, one of the better indicators of how long your rehab takes is how long it takes to get to outpatient rehabilitation. Getting out into the world and using your knee because your knee is ready to go the same day as surgery is the biggest limiting factor in getting you back to doing the things that you want to do and the reasons you had that knee replacement in the first place. Outpatient therapy should not only look at pain management, but help you recover loss of range of motion, both flexion and an extension. That's the straightening part, which I find is usually the part that most people are limited by in the long run. If you don't recover the ability to fully straighten your leg, it makes you really inefficient on your feet. You can't walk as far, and you may actually have new pain show up because you can't fully straighten your leg and your muscles have to work so hard to keep your knee from buckling. People get some advice after a knee replacement saying, oh, just go out and walk a lot, it'll be fine. I really don't think that's a good option for most people. It's a little bit of taking your rehab and just kind of leaving it to chance. With a surgery that's that involved, I wouldn't leave the rehab to chance. You didn't leave the surgery to chance, right? And so finding a therapist that can help tailor your goals, tailor your limitations, exactly what they see with your total knee, because they're all completely unique. The rehab process is individualized to every patient, is critical to making sure that your rehab is as short as it can be, your surgery as successful as it can be, and the outcomes are as good as they can be. If you've had a total knee and you're finding that you just didn't quite get back to where you thought you should get, and you should be able to get back to most things, give us a call or reach out to us online at Ascent PT NW.